Welcome to today's session on COVID in newborn. And to speak on the topic today, we would like to welcome Dr. Sugna Reddy, in-house consultant for pediatrics and neonatology. She's done her MBBS, DCH, DMB in pediatrics, and DM in neonatology. We welcome you, doctor. You can now take over the session.
Hello everyone, I am Dr. Suguna. Today's my session is about COVID in neonates. So, uh, we all know about the COVID since last 2 years. We are the most uh, mostly we will heard about COVID. So, what are the neonate? Um, what is the route of transmission in neonate, or what are the modes of transmission in neonate? How neonates are affected with COVID? So, three modes of transmission: intrauterine transmission, intrapartum transmission, and postpartum transmission, or immediate postpartum or late postpartum transmission. What is intrauterine transmission? How neonates are those babies born immediately born babies and less than 28 days age babies we will call neonates. So how neonates are affected with COVID-19? So first is intrauterine transmission. Intrauterine baby is inside the womb. Intrauterine transmission is very rare. Uh, it is through the hematogenous spread or inhalation or ingestion of infected amniotic fluid. This mode of transmission is very rare. Then second mode is intrapartum transmission through the infected vaginal secretions or infected blood, ingestion or inhalation of infected secretion. This intrauterine and intrapartum transmission, the intrapartum compared to intrauterine transmission, intrapartum transmission is little more common than postpartum transmission or immediate postpartum transmission. So transmission through the family members or infected mother through the respiratory droplets of the mother, or infected any family member or infected any healthcare worker. This mode of transmission is more common in neonates compared to the other two modes of the transmission. Late postpartum transmission, that is also after 48 hours of the birth. That is also through the mother or infected any family member or healthcare workers or any visitors. This mode of transmission is also common in the neonates. Mm, Then after transmission, what are the neonatal resuscitation? NRP is different if COVID suspected neonate, COVID suspected mother, or a COVID confirmed mother. So NRP or neonatal resuscitation guidelines are same for the any as per routine delivery. How we will attend the routine delivery? Same for the COVID suspected or confirmed. Only thing is if any personnels or doctors and healthcare workers who are attending the delivery, they have to wear proper PPE, personal protective equipments, and N95 triple layer mask, face shield, and mm, uh, goggles. The same. And along with that, delayed card clamping and skin to skin care is should be practiced. Resuscitation NRP guidelines is same for the routine delivery and COVID suspected or confirmed mother with COVID suspected or confirmed COVID-19 cases. Uh, then next, can we breastfeed can be breastfeeding is allowed or not allowed? So breastfeed COVID, if mother is having symptoms of COVID-19, 14 days, if mother is symptoms or mother is positive for COVID RT-PCR, 14 days before delivery or 2 days after delivery, we will call suspected or exposed to the COVID-19. So we can allow the breastfeeding. Like breast milk is allowed for the baby, and rooming in is also allowed for the baby and mother. So breast milk is contain viral RNA, but breast milk is not a route of transmission to the babies. So exclusive breastfeeding is allowed. Uh, and exclusive breastfeeding is allowed, and mother has to take care proper mother has to wear N95 mask or triple layer mask, and before touching the baby, and before handling the baby, mother has to perform proper hand hygiene, frequently wash the hands, and if baby is stable, like baby is normal asymptomatic, she can mother is also stable, we can allow the mother to feed direct breastfeeding. If mother is sick or baby is sick, we can allow the baby to take express breast milk. So breastfeeding is definitely it is indicated. She for COVID suspected or confirmed COVID-19 babies. Then rooming in also. Rooming in, if mother is suspected or confirmed case, if mother is stable, like mother is having only RT-PCR is positive, but mother is having only mild symptoms, we can allow her mother and baby in same room. But if space is available, better to place the baby and mother 6 feet away from the mother's bed. uh, and proper, like same thing, like proper hand hygiene, wear the mask, triple layer N95 mask, and frequently wash hands before touching the baby, before any uh, any activities with baby, before touching the baby, or like before giving the breast milk, direct breast milk, she has to wash her hands properly. Then uh, what are the warning? What are the next? What are the vaccination schedule for the COVID suspected or uh, COVID-19 confirmed cases? So if baby is stable, healthy baby, she can vaccinate according to the same vaccination schedule will follow for routine babies, like BCG, OPV, hepatitis B at birth. Same vaccination schedule she can follow. Mother, if baby is having mild symptoms, she is until like she required only Calpol or mild symptoms, she can follow same schedule, vaccination schedule. Only baby is affected with severe symptoms, or baby received for her health purposes, she received any IVIG or steroid dose, that too prednisolone more than 2 mg per kg per day, high dose steroids. These babies, live vaccines like rotavirus and OPV drops, we have to avoid for 4 weeks. But most of the babies, like asymptomatic baby or mild symptoms or moderate symptoms, required only normal respiratory support, normal normal respiratory support, or low dose steroids, only 5 to 7 days of steroid, that to less than 2 mg per kg. These all babies can take proper normal immunization schedule, like routine immunization schedule, routine vaccination. Babies can be proceed with routine immunization schedule. Then uh, breastfeeding is over. Then what are the warning symptoms or signs to the babies? Like if baby is stable, like mother is uh, చాలా questions ఉన్నాయి Nirisha. Okay. What are the like if mother is tested positive 14 days before delivery or 2 days after delivery, is the COVID test is done for the babies? What is the timing of the test? If mother is tested positive 14 days before delivery or 2 days after delivery to confirm the perinatal transmission. We'll do test at 24. Asymptomatic baby or a stable baby, will do test at 24 to 48 hours of life once, and then 5 to 7 days of life. But if baby is asymptomatic, no symptoms, we'll allow the mother and baby stay together in same room, rooming in, and we'll allow the exclusive breastfeeding. Mm, then symptomatic baby. If baby is symptomatic, like baby is having acute respiratory symptoms, respiratory distress, apnea, with or without cough, uh, then fever, with or without cough, respiratory distress, or sepsis like illness like fever, dull activity, poor feeding, seizures, diarrhea. These symptoms also, if it is there, so these are the symptoms of COVID-19. If these symptoms are there, it is better to do COVID-19 RT-PCR. What are the tests to do to confirm the COVID-19? Are the most common test is first preferable test is COVID-19 RT-PCR, then rapid antigen test or RAT test, 2 not and CB not also, but sensitivity, specificity is good for the COVID RT-PCR. Rapid antigen test is specificity is good, but sensitivity is very less. Then so what are the precautions? What are the precautions should I take to attend the delivery from mother with COVID-19? What are the precautions should I take to attend the delivery? So for to attend the delivery, proper PPE like personal protective equipments like uh, gown, N95 mask, face shield, goggles, and gloves. These are the proper uh, to attend the delivery. Proper PPE is required. Then during resuscitation also, if required, like if any nasal secretions are there, if anything it is there, then only do suction. So suction are these all are aerosol generating procedures. These all increase the risk of transmission to the healthcare workers and surrounding people. So avoid unnecessary suction, and like if required also do, if possible, use bacterial or viral filters. Then can mother, next question is, can mother and well newborn room in? Yes, mother and well newborn can be room in direct, can allow her to stay in the same room, but mother has to take care, and like mother has to wear 24, mother has to wear N95 mask, proper hand hygiene. If possible, if space is there, baby and mother 6 feet away from the mother baby. And should I test well newborn to determine if they are infected with SARS-CoV-2? Next question is, should I test well newborn to determine? No, until like if well newborn, if mother is positive, then actually to prevent the infection from the asymptomatic newborn to other other like family members and other family members and healthcare workers, to better to do one test at 24 hours of age. Then baby can stay with mother. The next question is there any advantage to early hospital discharge for new infant born to COVID negative mother? Mm, is there any advantage early hospital discharge for infant born to COVID negative mother? Yes, until like if more exposure will not be there. Now it is a pandemic, so early discharge it is okay. But then definitely if baby is discharged 24 to 48 hours of life, then better to see after 24 hours once, to see the jaundice levels and how baby is breastfeeding establishment is there or not there, and how baby is growing. So how to manage the stable baby Next question is how to manage the stable babies of COVID-19, COVID positive mother and COVID positive stable baby greater than 34 weeks in immediate postnatal period. So same as routine care, only if a baby, a stable baby without any symptoms, so baby can stay with mother. She can, if baby is stable more than 34 weeks, she can direct breastfeed also. We can allow. Mother has to wear a proper N95 mask and proper respiratory hygiene and hand hygiene. That's all. What are the supportive care recommended? Next question is what the supportive care is recommended for COVID positive or suspected sick neonate. Positive or suspected sick neonate supportive care that depends on the baby symptoms. Like if baby is having a respiratory distress, respiratory support, like depending on the percentage of oxygen saturation, uh, and like nasal flow oxygen less than 2 liters or a high flow oxygen more than 2 liter per kg or CPAP, HFNC. That depends on the baby X-ray clinical findings depending on the respiratory score, like a respiratory distress score like a Silverman and Anderson or a Downey score. Depending on the clinical status, we will advise the, we will follow the, but no like only supportive care, no role of antiviral drugs in neonates. Next question. Um, So, I want to conclude the session with two words, breath. So, COVID 19 in newborn is mostly 90% of the babies, not 90, almost 98% of the babies is uh, po- transmission is through the postpartum transmission or immediate postpartum or late postpartum transmission through the infected mother or infected family members or caretakers. So that is the most common mode of transmission, and most of the babies are asymptomatic. Mostly they don't have any symptoms. Then symptoms of the COVID-19 in the babies are like dull activity, fever, respiratory distress, apnea, cough, apnea with or without cough, and fever with or without respiratory distress, and sepsis like illness like other like a fever, dull activity, seizures, diarrhea. These are the symptoms of COVID-19. So babies can be like healthy baby, stable baby, allow the baby and mothers rooming in, and allow the baby and mother rooming in along with that direct breast milk. If direct breast milk is not possible because of baby sickness or mother sickness, we can allow baby to given like express breast milk. Vaccination for COVID-19 suspected or COVID-19 confirmed babies also, vaccination is same, only two or three special conditions like a baby is received high dose of steroids or baby per se her baby's health, if she received any like a IL-6 antagonist immunomodulatory drugs, then that condition we will not give live vaccines like rotavirus and OPV vaccine. Otherwise, vaccination is same for the COVID-19 confirmed or suspected babies. And one more word I want to tell, that miscan, multi-system inflammatory syndrome in neonate, miscan. It is very rare. Same like children, fever more than 3 days, age is 0 to 19 days, like uh, another two of any hypotension, shock, or myocardial dysfunction like myocarditis, pericarditis, or valvular dysfunction, or echocardiography, any abnormalities are there. Other like gastrointestinal symptoms like diarrhea, vomiting, abdominal pain, or any raised inflammatory markers like a raised CRP, ESR, procalcitonin, ferritin, and one more is like other other things like we have to first exclude the it is not bacterial infection like streptococcal or staphylococcal scarlet syndrome. It is not because of any other cause is not there. So then only miss can, like along with that rapid antigen or COVID RT-PCR is positive, and then will criteria are there in five. If five criteria, say six criteria is there, in that five it is positive, then we'll consider as a miscan. Miscan treatment depends on the, for miscan IVIG and steroids. That is also symptomatic treatment depending on the symptoms.